What we're doing here at the office regarding coronavirus is we're using the standard safety measures. We social distance, we're spacing out patient visits if you choose to come in. Some patients are still too nervous to come in. As I mentioned in another video, I've already had coronavirus. I have antibody testing several times that shows I have that long-acting IgG antibody, which means I'm relatively immune at this time, and I can't get it, I can't give it to you. So you're safe to come in. None of my staff were all tested routinely, and you're safe to come in. We space time visits apart so that you're not with other patients or around them. Obviously, social distancing, masking, gloves, and so forth. And if you're nervous, we can do telemedicine, and you can come in or not come in, and I can do a video conference with you over the phone. We have various techniques, but it's time for you to get out of pain and get treated and get better.